Hi, my name is Michael Westerhouse. I'm a primary care physician and an assistant professor of global health at the University of Minnesota. I would like to share with you an innovative early stage idea that has been formulated by a group with global representation called the Social Medicine Consortium. In October 2015, a group of Ugandan, Rwandan, Haitian, and American clinician educators convened. Two central questions brought us together. One, why is it that health professional schools throughout the world rarely include any training on the social determinants of health, when at least 80% of societal health outcomes in any setting throughout the world can be directly attributed to those factors? And secondly, how can we change that? During that day, we heard from Dr. Sandy Ojara, a physician from northern Uganda with a deep passion for teaching social medicine and with the belief that all Ugandan health professional students should be exposed to such training. We heard from Mark Jomis, the Chief Nursing Officer at Mirabole Hospital in Haiti, who delineated their successful efforts to integrate social medicine training into residency as well as community-based healthcare. We heard from Dr. Paul Pierre, a Haitian physician who challenged us to ensure that our educational models do not replicate the discrimination, exclusion, and structural violence against which we were teaching. A desire and commitment to reimagine social medicine that day gave birth to the Social Medicine Consortium. This consortium is a collective of individuals, organizations, and institutions who aim to drive a global transformation in health professional education that deepens engagement with social medicine as a core component of training, so that all students emerge better prepared to partner with patients and families, identify and respond to the social determinants of health, and advance health equity. Relationships with our local collaborators are many years long and deep. Key local collaborators include Dr. Sandy Ojara from northern Uganda, Emmanuel Mbire from Rwanda, and Carlos Luis Charles from Haiti. These individuals have spent many hours and days and years developing syllabi, implementing courses, and directly teaching social medicine. They are now key members of the consortium working groups, which were developed in order to organize ourselves as we move forward. These groups include a strategy and vision group, an academics and curricular group, a communications group, and an outreach and alliance building group. To measure the success of our consortium, we will utilize a metric called the Social Mission Score, which has been used in the United States to assess institutional commitment to health professional training on social medicine. This metric has consistently demonstrated an association with increased numbers of students graduating who wish to practice primary care, who come from diverse racial and class backgrounds, and who also plan to work in underserved settings. As part of our work, we will work to adapt this metric to each local context. Our consortium aims to increase the social mission score of affiliated institutions by 10% through a concerted effort to increase the number of curricular hours devoted to social medicine by 5%. As a next step, we have secured $35,000 from the Macy Foundation to host a 3-day international symposium on reimagining social medicine in April 2016. Key local collaborators from all of our various settings will be present as we continue to build our movement. Receipt of the Innovation Prize will allow us to push our efforts further. Were we to receive the Innovation Prize of any size, we would utilize this money to directly fund Ugandan, Rwandan, and Haitian faculty and students to directly participate in social medicine curricular implementation and impact evaluation. We are deeply grateful for your consideration of the Social Medicine Consortium.